Hello everyone, my name is Jeff. I'm a second year lab student at the Fiji School of Medicine. Today I would like to bring to your attention a tiny parasite that thrives inside human body by the name of Onchocerca Volvulus. First, I'll begin with an introduction, giving you guys enlightenment on the etiology, epidemiology, and classification of this parasite, followed by pathogenesis, furthermore, clinical manifestation, and life cycle. And then we have laboratory diagnosis, and finally, conclude with the ways of how to treat and prevent Onchocerca volvulus. Onchocerciasis, which is also known as river blindness, is an infectious condition of the skin and eyes that is caused by the parasitic worm Onchocerca volvulus. Onchocerciasis is transmitted by the bite of a black fly, a genus Simolium, that is infected with a parasite, usually in regions with fast-flowing river or stream, and is classified under the phylum Nematoda and family Onchocercidae. Globally, at least 18 million individuals have onchocerciasis, 99% of whom reside in Africa. Many black fly bites are needed before the disease can be developed. Infective larvae inoculate into the skin during the bite of a black fly and develop into an adult worms in 12 to 18 months. It is important to take note that adult female worms may live up to 15 years in the nodules. Females are 33 to 53 centimeters long and males are 19 to 42 millimeters long. The mature female worms produce microphyllae that migrate mainly through the skin and invade the eyes. So first one, the microphyllae mature into larvae in the gut of the stimulus fly, followed by the larvae which are introduced into human's bloodstream during the fly's next meal. And the onchocerca larvae are then transported throughout the body, but predominantly eyes and the skin, where they mature into male and female adults. After fertilization, the resultant macrophylla circulate in the bloodstream only to be picked by the black fly on its next meal, and then the cycle reoccurs. Moving on to clinical manifestation, onchocerciasis typically affects the skin and the eyes. The most common skin symptoms include intense itching and dermatitis, which is characterized by rashes. Chronic infection can lead to lichenification, where the skin becomes hardened and thickened, and it can be referred to as leopard skin. On the other hand, the skin becomes thin and wrinkled, and the formation of subcutaneous nodules housing arrowworms. For eyes, the clinical manifestation of eyes, the eye is going to become itchy, redness, and or photophobia, maybe the early symptoms of ocular onchocerciasis. So over the years, the progression can cause visual loss and ultimately blindness. Life cycle of Onchocerca volvulus. As you can see from the diagram here, we have stages 1 to 9. And the first one, an infected black fly bites a person and deposits Onchocerca larvae into the skin. The larvae then enters the bite wound, followed by the larvae move into the tissue under the skin, subcutaneous tissue, and form lumps or nodules. The larvae develop into adult worms in the nodules, and the adult females may live up to about 15 years in these nodules. And in the stage 4, after mating, the mature female worms produce eggs which develops into immature forms of the worm called microfilariae. The worm may produce 1000 microfilariae each day. The microfilariae typically live in the skin and the lymph vessels, but are occasionally present in the bloodstream, urine, and sputum. The stage 5, in which the infection spread when a black fly bites an infected person and is infected with a microfilariae. And in 6, after the microfilariae are ingested, they travel to the middle part of the fly's gut, which is the midgut, then to muscle in its midsection. There, the microfilariae developed into larvae. And finally, the stage 9 of the life cycle, the larva has to travel to the fly mouthpart and can be transmitted to other peoples when the fly bites them. There are 4 main laboratory diagnoses of Onchocerca volvulus. The first one is microscopic examination, where a small piece of skin is taken, typically from the crest or calf, and then incubated in saline solution. The microfilariae emerge from the skin sample and can be observed microscopically. And then followed by serological test, which the test detect the antibody against or Onchocerca volvulus. Enzyme link immunosupplement assay and immunochromatic test can identify specific antibodies in the patient's blood indicating exposure to the parasite. And then we have PCR, polymerase chain reaction. PCR detects Onchocerca volvulus DNA in skin, sneams, or blood samples, providing highly sensitive and specific diagnosis. It is especially useful in low-intensity infections where microfilariae might be scarce. And lastly, Masotti test, historically used but less common now due to safety concerns. These tests involve administering diethylcarbamazine and observing for a localized skin reaction indicating the presence of microfilariae. Ivermectin and doxycycline are the 2 main common treatments that WHO recommended for treating onchocerciasis at least once yearly for 10 to 15 years. It works by killing the microfilariae in the body, and these 2 treatments are antiparasitic drugs. For the adult doses, the adults will have to take 1 dose every 6 months, and for adolescents, they are preferred to take 200 milligrams orally daily for 6 weeks. The following may help reduce the chances of being bitten by a black fly, and thus it will reduce the risk of onchocerciasis. The first one, number 1, avoid black fly infested areas. Number 2, wearing protective clothing. And lastly, liberally using insect repellent. So as I've already mentioned, ivermectin, a antiparasitic drug, is given once or twice a year just to help reduce the number of microfilariae, and thus it helps to prevent the development of feather disease, and it also helps to control the infection in people who are repeatedly exposed to it. Thank you all for your attention.